Our first one up is Nathan Lachowsky. He's going to be presenting on the use and impact of online outreach services among gay men in Ontario.
Good morning. Okay, so I'm going to be taking us east to Ontario. And there is a bit of connection between Hustle and this study that I'm here presenting on behalf of my co-authors, Dr. David Brennan and others at the Factor Inwintosh Faculty of Social Work. In that this study is a two-pronged study with a qualitative interview component and a quantitative questionnaire. So I'm going to be presenting on the latter, but our online outreach qualitative interviews have been included participants here in BC, but also in other parts of Canada and in the United States as well. So if we have time and are interested, I can talk a little bit about that research too, because I have some slides hidden away. But anyways, what I wanted to thank was this project, which is a very large community-based collaboration in Ontario. These are the pretty logos of all of the different groups that are involved. But these are the individuals who are behind those organizations representing them on our study team. And I'd also like to acknowledge our community advisory board, the 4 gentlemen from different parts of the province that sort of give us feedback as we go throughout the project. So I don't think I'm going to have to convince anyone of this, but the internet has proliferated a variety of opportunities and tools for guys to use for many different things, seeking information, social networking, sexual partners, things like that. And some research has shown that meeting guys online can be associated with increased risk. There's still debate on this sort of piece, but I think largely it's something that we're interested in trying to understand better, and really what factors are related to increased risk or not, because we know it's not sort of universal. And the other piece, there was some interesting qualitative research done by Rhodes and colleagues that looked at online chat rooms, and they sort of spent time ethnographically in these online chat rooms and interacted with guys. And what they sort of found was that a lot of people generally have a lack of HIV knowledge, basic HIV knowledge, as well as things like how to use a condom, the things that we sort of take as sort of HIV 101 kind of pieces of this work. And they had questions about testing, where to get tested, how the process was going to work, what's going to happen with their name, if it was a positive diagnosis, those kinds of things. And also that the resources they felt available to them online weren't meeting what they wanted and what they needed. And so that's sort of the background of the sort of the literature that led us to this project. In terms of the community part, what they found, what we found across the province is that some agencies had started doing this online outreach. And were providing these services to guys. And they really were just doing it because they were like, these are where the guys are at now. Some of our in-person outreach may not be working, or we know that there's different guys online that we're not meeting in person. So they had sort of done this from a community need point of view. And so these sort of two things meshed together into this project. And so as I said, there were a number of AIDS service organizations that were doing this work in Ontario. Some of them had stopped doing it because there was too many challenges that they'd faced. Some of them are continuing to do it now. And since this project has started, which was about a year ago, quite a few have also started doing it now. And a lot of this work is meant to try and feed into that program and developing resources for providing online outreach. So today what we wanted to look at was how did guys experience online outreach, who experienced it, and what did they sort of talk about in terms of the impacts it had on them. So as I said, it's a community-based study, and there's 2 parts of it. Our online questionnaire had 1,800 guys fill it out. We did it over the winter holidays in December and January. We still at some point are quite interested to look at the results based on the guys who were filling out our survey, which largely recruited from Grindr and Squirt, who were doing it on Christmas and like New Year's Day and things like that. There was probably some interesting day differences there. But we also recruited through our community organizations, their listservs, their social media, things like that. The survey itself was anonymous and self-completed. It took about 15 minutes. And we used the Platform Fluid surveys, which had a really good mobile version for the survey, which we found really helpful. In terms of eligibility, guys need to be at least 16. They could really have any sexual orientation or sexual practice, so we went as broad as we could go with that. We also included, I don't know if it's up there, this idea that guys were interested in having sex. So they didn't need to necessarily have had sexual behavioral debut. And in terms of the internet, they either had to have used it or be interested in using it for sex or health. And they needed to live or work in Ontario or visit there with some degree of frequency in the past year. So I can talk a little bit more about the stats if people are interested. We have some quant data that we took from the questionnaire that we basically are just going to show you the descriptive statistics of, a little bit of regression, and then the qualitative work, guys could respond to some of the questions with open-ended text responses. And these were manually grouped and coded into themes. So this is what our sample looked like. pretty good age range. In terms of gender, predominantly cis men. Most were Canadian citizens. 3/4 were employed full-time. We had about 3/4 gay, 20% bisexual, the remaining sort of a variety of queer identities. In terms of geography, we had very happily a good range across the province, because I think largely we're always worried about sort of this being very urban-centric. And part of the reason that a lot of agencies had moved to these services is to try and reach people where they weren't in their urban centers, even for the ones that are in smaller cities that have a huge catchment area. So we had 30% of guys from Toronto, but we had 7% from Northern Ontario, and all of the other regions of Ontario are in between 7 or 29% of the sample. 8% self-declared HIV positive, 12% were unsure, the remaining were negative, and that's our breakdown by race ethnicity. We had community-based partners in a lot of these communities, and we had really wanted to try and oversample as best we could. The census would say that the race ethnicity breakdown in Ontario is about 72% white Caucasian, so we're still oversampled there and therefore undersampled in a lot of the groups, or the other groups that are there. So this is a continued struggle for us in terms of trying to reach these groups. And we had done particular outreach and advertisement on sort of more ethno-specific apps like Black Gay Chat, to try and reach some of those guys. So this is the range of different apps that guys said they used. I just wanted to give you a quick sort of picture. There are a ton. You can look up there for your own favorite apps, or ones you can be like, oh, that's where everyone is now. We did recruit from Grindr and Squirt, which are the two on the bottom that reported the most. But I think the thing here is that there's a huge range. And a lot of our providers talked about the challenge of where do we provide these services, because it's really hard to be simultaneously on all 54 sites. So that's just sort of, I mean, probably not surprising to people, but it's a fun chart. And we sort of asked guys, when are you online on these apps? Because that was an important piece for our providers as well. And so we sort of broke it down by weekday. This chart shows by weekdays is the blue in the morning, and red in the background is the weekend. We were sort of surprised, but it's sort of generally is guys are online all the time. And there's definitely a peak in the evenings. You can see them both weekends and weekdays, but for the most part, I mean, there's a good chunk of the guys that were sort of online, 40% almost routinely. So what did guys say about online outreach? Overall, about 13% of the sample had online outreach experience. So 8.1% of that 13, or not of that 13, but 8.1% contributing to that 13.3% had sort of contacted them when they were looking for health information. Okay? And then 8.2%, which overlaps with some of those other guys, had reported what we sort of used as our definition, which was that they had a contact with an online outreach worker, whether an interactive real-time or not, that went back and forth with this worker online. And that sort of, I mean, we were like, ooh, I don't know if our community partners are going to be happy with that. And they were like, that's great. The fact that like we would say that we've reached 13% of guys with this program, like that's actually like we're pretty happy. And we've looked at that a little bit broken down by some other pieces. But I think what's important, oh, and I just showed you these ones on the left to show you how much time guys are spending online. That's sort of their reporting. So I mean, guys are there a lot, and I think obviously there's an interest in increasing the amount of guys who have exposure to online outreach. And I think even if we did the survey now, comparatively to when we did almost a year ago now, we'd probably see this go up as well. And fortunately, we saw that encountering the services, so having had exposure with online outreach, didn't differ by age, education, sexual orientation, or geography. The only difference we saw by race ethnicity was that Aboriginal guys were more likely to have actually used these services, which is a good thing, I think. We're not entirely sure why, and unfortunately we don't have a question that we can get at qualitatively to understand that, but for the most part we're happy that we're not seeing any disparities there in terms of service access. So I think that speaks to when we sometimes see service barriers in other kinds of delivery models. This was a good news story for us as well. And I think what's most fascinating for us is this piece, is that 68% of guys said they don't need these services. And it's like, well, it's just someone to chat with, and you can ask them anything. I mean, it's sort of interesting in some ways. I'm like, well, so we're trying to work out now sort of this piece around why guys are perceiving that they don't need these services. But a third of them weren't aware of them as well. So I mean, there's a lot of work to do just in terms of trying to get guys exposure to these. In terms of how guys describe the providers, this is a sort of good news slide as well. So I mean, the vast majority were saying that they were friendly, easy to understand, helpful, prompt, and knowledgeable. And 50% of guys said they received a useful referral, which I think is good news. And I think out of the guys that had experienced, only like 1 out of 8 said they had no interest in using the services again. So they were totally satisfied and therefore had no need ever in the future again. In terms of the impacts, I just wanted to sort of start by saying 10% reported no change, okay, which means 90% of the guys that had these services said that they got something out of it. Okay, and so this chart then shows the different kinds of things that guys said that they did as a result of their online outreach experience. So it ranges sort of from 50% of guys said they now are going to be practicing sewer sorting or do sewer sorting differently or better, something related to that. And you can see that in condom use, during sort of disclosure, they felt more empowered, testing for HIV and STIs, better connected to community, to friends, to partners, feeling less anxious, increased knowledge, more comfort with their sexual risk, and a better understanding of their sexual risk were the two most poignant things that came out in terms of what guys were getting out of these services. How am I doing time-wise? Oh, I'm okay. I'm okay. Which is good, because this is the summary. So I think while current provision sort of seems limited, I do want to sort of reflect that our community partners were pretty happy with that percentage. And when you think about that, like, do we have any programs that reach every man, right? Like, is the expectation that would be 100% coverage and experience? But that 68% that don't believe they need these services is an interesting group that we're trying to understand. And I think it speaks to how we need to sort of market these services as well, so that guys have an understanding of exactly what could be provided online. And fortunately, there is no apparent discrepancy or inequity in terms of the uptake of these services. And I think certainly our study team and partners believe that online outreach is a promising health promotion strategy that can really engage gay men in health education services and health services as well. And I think they had very, very positive evaluations. And I think the 50% useful referral was a big piece for us as well. I mean, a lot of these often are just sort of casual chats. You can imagine what some of them look like. I think we'll hear from you guys a lot more about what that sort of program looks like on the ground. And that really there's a wide range of self-perceived impacts. I mean, when we think about some of the campaigns that we do online and the other work we do, often it can be quite targeted in terms of the thing that we're looking to have an impact on. But this kind of service delivery model worked for a range of different prevention approaches, a range in terms of changing attitudes, increasing knowledge, and sort of comfort with one's own risk. So that's all I've got. I did present this paper on behalf of Dr. Brennan, who's an associate professor of social work at the Factor and Natasha School of Social Work in Toronto, and an applied HIV research chair from the OHTN. I did want to thank the OHTN, who are the funders for this project, which is the Ontario HIV Treatment Network, for those who are unaware. If you have any questions, I'm happy to obviously answer them now in the time I've got left. Otherwise, you can always email David as well.